part of the Wednesday morning show with me for over 30 years here on WAKR. My good friend, Dr. Joe Congini, now joining us live again. Dr. Joe, good morning. Thanks for joining us. And what insight into the world of sports medicine do you have for us this morning?
Well, the road I'm going to go down today, Ray, always going down these different roads. The road we're going to go down today is more cutting-edge therapy. Some people and even high-level athletes may not know about this. Others may use it on a regular basis. But I want your audience to know about a technique in our physical therapy department. It starts mainly, but some high-level athletes then learn how to do this on their own. It's called blood flow restriction therapy. BFR, blood flow restriction therapy. And blood flow restriction therapy, it actually had its roots and beginnings in Japan. A lot of Japanese weightlifters used to use this, oh my gosh, Ray, 50 or 60 years ago. And of course, a lot of our physical therapy people in the United States began to make adjustments to it, make it useful for our athletes. And now it's a pretty regular thing we see in higher-level athletes in the sports medicine clinics around. For people especially that are trying to get back from an injury that has them out for a period of time, rather than just being on the sidelines and not being able to do anything and losing all that strength they've gained, BFR is something that allows them to maintain and actually grow some of that strength. So let me explain it just a little bit. Blood flow restriction therapy uses specialized, they call pneumatic cuffs, like blood pressure cuffs, to safely restrict the venous blood flow out of the arm or leg, the limb that you're working on, while you maintain arterial blood flow. If you switch over into where you're blocking arterial blood flow, you'll know about it. It's painful and stuff. So you have to be in that sweet spot where you're blocking the flow from the vein, but not from the artery. And you will see there's a lot of people that working in gyms, like I said, you'll see them using these bands that they use, elastic bands, to do the same kind of thing. But when we're working with a high-level athlete and we're really trying to make sure that we're exact with this, we like to use the specialized blood pressure type cuffs so you know exactly how much pressure it's taking to block this blood flow. And so during this period of time, it triggers muscle growth and strength gains that are identical to heavy lifting without putting the heavy stress across the joint in the injured area. So it was ideal. About 10 years ago, the director of physical therapy at our place at the Sports Medicine Center, Mindy Coldsnow, Mindy came to me and said, hey, gosh, athletes are using this, high-level athletes everywhere, and we want to start using this down at the Sports Medicine Center. And we began using it there. And I have to admit, Ray, we have a lot of younger athletes. I'm not totally comfortable in using it below in the junior high age range. When we get up into high school and we're particularly, higher level high school athletes, I think it's a really great therapy, and trying to explain a little bit about how it works. But it's an ideal for post-surgical rehab, too, and post-injury. So after these people have had their surgery and so forth, they'll start at a lower level and increase that level as they go. And the applied pressure creates this hypoxic, which means low oxygen, but high metabolic stress in the arm or leg that we're working on. And it's kind of described as it kind of tricks the brain into recruiting these fast-twitch muscle fibers, which are used really only during strenuous heavy lifting, and yet we're not putting heavy loads on the injured area. So you achieve significant muscle gains, muscle hypertrophy we call it, growth of the muscle, and strength gains, but minimal stress on the injured joint. The other benefit from it is that there's the release of systemic growth hormones during this period of time. These workouts often are 10 or 15 minutes is about what these athletes can tolerate. 15 or 20 minutes maybe at the most. You'll see these going on in our physical therapy area. And this prevents that atrophy that we used to see. So people are just sitting there with the injured or post-op joint for a month, And, of course, they're going to lose a lot of the strength they gained. And now with blood flow restriction, we've been able to blunt a lot of that or get rid of a lot of that loss of strength or that atrophy that occurred. So these cuffs are placed at the very top of the arm or the leg. Usually they're using the arm or the leg. I'd say in our clinic it's probably, 3 or 4 to 1, the leg more than the arm. But the therapist inflates the cuff to this specific personalized pressure. Again, not too much to cut off arterial flow, enough for the venous flow. And they know what that pressure is, and they can increase it as time goes on in those first couple weeks of trying to keep people rehabbed while they're coming back from an injury. It's about 20 to 30% of their maximum effort for multiple sets of these this technique. I really am strongly in favor of early on, especially in people that haven't used it, especially in younger athletes, to have professional guidance. So people like everyone really who's on our team and specialized in sports physical therapy knows how to do BFR in this day and age. It's become pretty standard for a higher level athlete who doesn't want to lose everything that they had gained before. And again, Mindy oversees this, makes sure that anybody who's on our team is doing this. The only really contraindications, anybody who has a history of blood clots would not be a good candidate. Anybody with, vascular or blood vessel diseases or active infections, those are really the only contraindications to not being able to do these. And so it's a real good jump start, and then after a couple of weeks, they're back to being able to work on their own. Now, if you like me, go to gyms, you'll see people with elastic bands kind of on their own doing, maybe they have done this for injuries elsewhere and they feel comfortable doing it on their own. But I think at the beginning it's really important to have some guidance. I said that before, by some of these sports physical therapists who understand how to do it, so you're not getting into trouble with it. But certainly for more serious athletes. This is not for Joe Congini working out at his gym. This isn't something that's for an average athlete to be working out. But for people, and you know how people train for certain things, and they're already using most every, lots of different things that they can do to be the best athlete they can be. And when they're training hard, one tool that really should now be in their toolkit, especially post-injury, is blood flow restriction therapy, BFR. And I really wanted your audience to be aware of. Ask your therapist about it if you're not getting it. You might learn it if you're really working for something high level that you're shooting for. And I wanted your audience to be aware of some cutting-edge therapy.
Joe, let me ask you this, because I'm getting into your arena here. This blood flow therapy, is it similar to what we've seen as far as this cupping that has grown in popularity in the last decade? Is that similar?
No, it's very different from cuffing. So cuffing is a treatment that's used, Ray, to break up some of the scar tissue that occurs in the soft tissue, the muscle tendon units. And so cuffing is a modality that's used in treatment to get blood flow going into an area over time. Right. This is a technique that's used in a 10, 15, maybe at most 20-minute workout, high-level workout, where we are tricking those muscles into strengthening and hypertrophy and the release of some of those hormones that are going to really help with healing. So, no, this is quite a bit different from cupping. Gotcha. Blood flow restriction therapy. And again, I know it's a step into higher level stuff, but you have a higher level audience, Ray, and I wanted people to be aware of it. And certainly a lot of people that are already getting therapy with sports physical therapists, or even in some situations the athletic trainers pick up on that. The athletic trainers can be doing some of this, and they could ask questions about getting this done. It's moving up to pretty standard therapy in higher level athletes.
Understood. Joe, great information and real cutting edge information as well. Thanks for putting it together and educating us this morning, my friend, and we'll get together again next week. Thank you.
Sounds good, Ray. Have a good week.
You too. Dr. Joe Congini, love that guy, and he's been part of my show for over 25 years, but actually he was on WAKR even before yours truly arrived. He loves educating in the world of sports medicine.